Okay, in this I'm going to look at some of the defects in blood pressure and also the defects in vessel health. Okay, so we're going to start talking about circulatory shock. So circulatory shock is actually really a critical care issue. Okay, so if you think about the number of emergency room acceptance, about 25% happens when people faint. Okay, and people faint for various reasons, but one of the reasons is that their blood flow is unable to meet the metabolic demand of their brain, so the brain shuts down and they faint. Okay, so blood pressure is the main issue sometimes, and if there's not enough blood pressure, again, blood is not delivered to the brain, there's not enough oxygen, not enough ATP, so the brain shuts down and then they faint. Prolonged circulatory shock, or when blood pressure is really critically low, the brain can start shutting down, the patient go into a coma, and this can lead to fatality. So let's take a look at shock. So shock, again, is looking at three factors. This is, again, not new information, but application of what you already know. So remember, the three factors that affect blood pressure can have pathologies with them. One is low blood volume. So that's hypovolemic shock, low volume. This happens when too much bleeding, extreme burn, dehydration situations, when blood volume is really low. And then there's low cardiac output, where the heart is just unable to pump. This is called cardiogenic shock that originates from the heart, and this happens with myocardial infarction. So think about how many ER acceptance are due to a heart attack. Okay, and then there's also too much vasodilation or inflammation. Okay, and this results from anaphylactic shock, like this baby right here. Poor baby's allergic to something and everything's swollen. And she's obviously looks very sleepy because there's not enough oxygen going to the brain. And then there's also septic shock. This patient has a infection somewhere and is causing real large swellings in the leg. So when there's unusual swellings in the body, that's an extreme vasodilation, okay? And when that happens, blood is going to areas that it should not be going, so then there's less available for the brain, causing shock. Okay, so I want you to really think about how would you treat this? How would you treat low blood volume? Can you give them fluid? How would you change low cardiac output? Can you shock the heart back, make the heart pump as soon as possible? And there's too much vasodilation. How about all those hormones that causes vasoconstriction? Can you treat those patients with those medications? Okay, so those are things to think about, and there's questions that relates to that, and also is on the practice quiz. Okay, we'll also then move on to a few more pathologies. One's atherosclerosis. Atherosclerosis is a disease where the artery is getting a lot of buildup of fatty material causing plaque formation. Okay, this is especially dangerous because blood should be flowing through easily, but as atherosclerosis gets more advanced, blood is not getting through, and anything downstream of here is now having low O2, ischemia, or tissue death. So this is the primary cause of myocardial infarction, stroke, and other diseases. There are treatments for this, and I have a couple of videos that's just more interesting. There's a lot of info in it, but it's actually interesting to see what happens. So if you have a blocked artery, you can get a picture of it, and that's using an angiogram. And you can figure out where the blockage is, okay? So that's called angiogram. And it's gonna, then once you know where the blockage is, then you're gonna use ways to open the blocked artery. One way is called angioplasty, plastic surgery on the vessels with stents. And that's gonna use a stent to open up the blockage. Or you can use what's called CABG, or coronary artery bypass with graft. So you're gonna take another artery or vein from another part of the body, and you're gonna connect blood flow to downstream of the blockage so that you cannot allow blood flow to this region. Okay, so I want you to think about those things. And I also want you to understand the steps to form atherosclerosis. Again, this is the picture and the steps that goes along with it, okay? So first off, step one for plaque to form is that there has to be endothelial injury. Common endothelial injury is high blood pressure causing the vessel to stretch and damage. So as it damages, then lipid can start seeping through, LDL, can start seeping in between the tunica intima and the tunica media. So it starts filling in here. And then there's a few other steps that I skip just for purpose of less complication. But cells start coming to try to take care of that, but then causes a huge debris of the cells, debris, cholesterol, and the calcification of all that forms a plaque. And this will narrow the artery. So as plaque builds over time, you can go from 50% blockage to 85% blockage to 90% blockage. Well, as blood passes through here, blood is pounding the endothelial layer, the tunica intima, and then that's gonna cause a tear in that layer, and then when there's a tear, the blood wants to clot. And as it clots, you go from 90% blockage now to 100% blockage. Now everything downstream is not getting any oxygen, so a patient can have a heart attack or stroke. Okay, and that is explained here as well, and you can practice those questions as well. The last two is just, I just want you to really just be exposed to the last two pathology. It's a pathology of again, blood flow and vessels. So one of it is aneurysm. So aneurysm, when there's a weak point in the artery, and this can happen in a lot of places, but one of the places in the aorta. Obviously, the aorta is a main vessel in the body. So in this case, there's an abdominal aortic aneurysm, AAA. And this abdominal aortic aneurysm is bulging. So sometimes patients will feel something and come in, then you can fix that or monitor that. But if this ruptures, within minutes, the patient is dead because the blood is so severe. There's also cerebral aneurysm, and here's an X-ray showing the cerebral aneurysm. And what's going on is that here you see a bulging vessel. Okay, so you can detect that. And there's a bulging vessel, then that's going to cause, if it bursts, then the patient can have a hemorrhagic stroke or a bleeding stroke. So you can watch videos and look at what the risk factor, but that is a weak point in the artery where it starts to bulge. Embolism or embolus is anything that blocks blood flow. So this can be clot, could be fatty material, could be bacteria, but most often it's a clot. So patients will typically have a deep vein thrombosis from the lack of movement or hospitalization. And the clot starts forming, and when the clot dislodges, it'll start moving upwards towards the vena cava and go in to the right atrium and start going through the right ventricle to the pulmonary valve, pulmonary trunk, pulmonary artery, and then lodges in different parts of the lung. This can cause fatality because now lung tissue is going to start dying because of the lack of oxygen. So pulmonary embolism is quite a serious illness. So I want you to just kind of know this too, so that you're aware of it in the hospital. And then we have a few practice problems that you can kind of practice and get used to it. And then we have also a few more review questions. All this will be on the quiz. Because there's so much review on this unit, and I put all the notes into one packet because it's right before the test, we will have two quizzes, quiz 7, 7.1 and 7.2. Each practice quiz is worth 5 points, and those are due on Wednesday because you need to prepare for the test. That's at the end of the week. Good luck. If you have any questions, please ask. I will have office hours, Q&A sessions, and you can always email me. Good luck.